We will be recording, so please be sure to avoid sharing any protected health information. I'm just going to go over our housekeeping rules really quickly. Use the chat if you have any questions. We will be managing the chat and checking it to answer your questions. To get these slides, they will be available on the HICPUF TSAC page where you can download them. If you are calling in by phone today, you can press star 6 to unmute your line or star 9 to raise your hand. You can click the CC icon at the bottom of your screen to get closed captioning. And if you do need accommodations for this meeting, because right now we're not allowing any AI or any third-party recording or technology devices, but if you do need accommodations, please email john.r.berry@state.co.us. It's right there on that screen, and you can access it that way as well. Okay, just go over a little bit of what we do here at the Department of Healthcare Policy and Financing. We administer the Health First Colorado program and the Child Health Plan or CHIP Plus and other healthcare programs for Coloradans who qualify. And our mission here is to improve the healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. And we always like to go over our mission and what we do because it's a good reminder of why we're here and why we do this work that we do. So our agenda today, the agenda is a little light today because we do recognize that it is before a holiday, but we are still going to save this time for you and this space for you to meet. And we're going to go over a few things. First thing is going to be a nutritional support update from our benefits and policy specialist, Morgan Anderson. Next, I'm going to go over the poll results from our meeting back in June. And then we're going to discuss some future meetings and things like that and how to best use this space as we go forward. And then we'll close with questions and open discussions. So I will turn it over to Morgan and she will go over the nutrition update for you or nutrition support update for you.
Thanks, Jay. Can you hear me?
We can.
All right. Hi, everyone. I'm Morgan Anderson. I am the primary care unit supervisor here at HICPUF. And what that really means is that myself and my team oversees a lot of the benefits for Medicaid members that kind of sit on our fee schedule reimbursement. And nutrition has been one of the areas that we've started to lean into. And I just want to start off by saying the nutrition I'm going to talk about today and those services is part of the 1115 demonstration waiver. I recognize that there are other federal programs and state programs and even HICPUF programs through other waivers that may touch on nutrition, but I am here to talk about the 1115 demonstration waiver. And so just to start us off, this isn't on the slide because normally there are housing experts on a call with me that talk about this, but I did want to kind of frame that the 1115 demonstration waiver that got approved in January for Colorado is the nutrition portion of it is really tied to housing. And folks that are going to be eligible for these nutrition services I'm going to talk about are going to be on housing vouchers. And those three vouchers include permanent supportive housing. We call that PSH. There's also going to be a voucher for community access team. That one goes by CAT. And there's a voucher called Colorado Fostering Success or CFS. I am not the housing expert, so I don't have all the details on the eligibility behind those housing vouchers. But I just wanted to really set the tone that this 1115 waiver and our current nutrition benefit is really tied to housing benefits. Colorado is interested in looking beyond that in the future to look at nutrition beyond just housing vouchers. But our current authority and the way we're going to implement this coming up is tied to that. So we can go to the next slide. I just wanted to level set there. Okay, so these are the three kind of categories of nutrition that our 1115 waiver really talked about. So I'm going to go through each of these and a little bit of their implementation dates. Phase one of our waiver just went live 2 days ago, but that is for the housing vouchers. And then nutrition is going to start in what we're calling phase two. And that's going to start no sooner than January of 2026. And then you'll see towards the end of the slide that there's a January 2027 date. We're calling that phase three of the waiver. And so just phase two and three of the waiver have these nutrition components. So let's start with nutrition counseling. That's the first one on here. This includes any combination of educational strategies designed to motivate and facilitate voluntary adaptation of food choices and other food and nutrition related behavior choices that are conducive to health and well-being. This can be evidence-based nutrition education. It can also be meal preparation in a group or an individual setting. And then the next portion on here is home delivered meals. And you can see it's and pantry stocking. It's kind of an either or. And so home delivered meals is a recipient gets prepared hot foods, meal kits, or restaurant meals, and those meals must take into account the member's household size and be administered through a voucher or prepaid card. And then the dietary guidelines for Americans to encourage healthy food selection have to be used for those. The pantry stocking portion of this section. So it's like people can get these home delivered meals or they can get pantry stocking. And that includes groceries that can be picked up or delivered to the member's home. And they may take into account the member's household size and can be administered through a voucher or prepaid card. And again, takes those dietary guidelines for Americans into consideration and what is included in the pantry stocking. And then the last box on here is medically tailored meals. That'll be our last phase going live no sooner than January 1st of 2027. So we definitely got a little time there. But it includes meals that are tailored to support specific individuals for which it's going to improve their health outcome and diagnosis. This includes preparation and provision and delivery of the meal. And they have to be consistent with a care plan that it can include up to 3 meals a day for 6 months. And each meal must contain sufficient food to support approximately 1/3 of the individual's daily nutritional needs. So if they get 3 meals a day, 1/3, 1/3, 1/3, that equals all their nutritional needs in a day. That's how that math breaks out. Let's go to the next slide. All right, eligibility for the nutrition services. I kind of touched on this briefly, but it's those 3 vouchers, the PSA, the CAT, and the CFS vouchers. Folks that are on those vouchers are going to be eligible for these services. And then they're going to be needed to be screened to ensure that there is like a kind of health related social need related to nutrition also. And the screening requirements are still being determined. I'm going to talk about this soon, but we have some upcoming webinars this fall to get a lot more feedback on some of those requirements. And then kind of this last bullet is true for a lot of our Medicaid fee-for-service benefits, is that they're going to need to be medically appropriate, and that's going to need to be documented. So kind of, again, we're going to talk about that coming up, but we can go to the next slide for now. Yeah, so where we are in the process and whatnot is that we are deeply in the design phase right now. We have some upcoming webinars in August, September, and October, and I'm going to drop a link in the chat for folks if they want more information. And it's really going to go into a lot of depth and detail into what we are proposing for these benefits and what we want feedback on. Our screening requirements in alignment with how case managers and housing folks and nutrition providers are screening for folks, our documentation requirements feasible, things like that. So I'm dropping this in the chat. I hope everyone gets it. On that webpage, you're going to see that there are some sections for upcoming webinars. I noticed that the link isn't live for the fall webinars, but we're taking care of that. There will be a Zoom link for that. And so we would love folks, if they're wanting to know more or provide feedback, to really attend these in fall webinars that are really going to be in depth and asking a lot of questions, a lot of poll questions, discussion questions that are going to help us understand that the benefit we are proposing and implementing is feasible and not hopefully putting up more barriers than necessary. And we always have to have a lot of documentation requirement, but hopefully we can make it as streamlined as possible. And we would love people to attend. So let's go to the next slide, which I think is just a question slide. So I know it was high level, but would love to field any questions now. And if I know the answer, I'll answer it. And if not, we'll definitely add it to things we can discuss this fall. Yeah. If there are any questions, that's totally fine. Or if you think of any, I think the next slide has our contact information. We do have it's this waiver has its own inbox and the whole team monitors it. And yeah, you can find out more information on that. I also dropped that link to that HICPUF HRSF webpage. And would love to hear from you. I think that's all for me.
Thank you, Morgan. I was checking the chat too to see if we had any questions come through, and I haven't seen any, but if you all have any or just want to drop them in the chat, just let us know. Amy says thank you as well. So that's great. Thank you for that information. And also thank you for dropping the links for the meetings this fall. That's going to be great. And I'll be sure to share that with others as well. So
Yeah, thank
appreciate that.
you.
Okay. So what we'll get to next is our poll results. And it's really timely to kind of segue into this discussion next because the poll results did inform who we invited to come to speak at this meeting for July. So just as a refresher, we'll talk about some of those topics that we voted on last time we were here, just in case you weren't here. Then we'll go over the results, and then we can talk about how that informed how we invite guests, how we plan this meeting, how we're planning future meetings. Okay, so the poll topics that we were voting on last time in June are listed on this page right here. So it was HCBS 101, waivers 101, participant directed programs, MREACH, SUD, food and housing support, and adult protective services. So those were the 7 topics, it looks like, that we voted on last time. And then just also want to say thank you because we had a really good participation in that poll voting. So it really did help inform us on how we should plan and to use this space going forward. So we do appreciate everyone participating in the poll. So we really know where to go with this meeting. Next page, please, or next slide, please. So we are presenting the information from the poll in 2 different formats. We have the pie graph first, and we're going to have a bar chart next, but we'll get to that. But as you can see, food and housing was the top voted one that you wanted more information about, or that we as a group wanted more information about. And that really is what informed us reaching out to Morgan to invite her to come talk about nutrition support services today at this meeting. So it was really timely and appropriate to kind of follow up June with this information for July. And as you can see, we had a really good voting overall, and everything was kind of split pretty even, 12%, 14, 15, but the highest was food and housing. So we do recognize that there is a need there over more information, resources, and all the things that are going to enable you to serve the members. So that's good information for us. So this is the pie graph. That's all the information you can see. We can go to the bar chart next. And we just put it in 2 different formats, like I said, to make it digestible for you so that you can view it in 2 different ways and see the difference between everything was pretty much 14%, right around that amount, 12%, except for the food and housing. Are there any questions about the poll results or any suggestions on how we use that information to inform how we invite guests to speak during this space? And how do we all feel about the poll and participating in that, voting on these topics? Like I said, the participation was really high, so it seems like it was something you all liked. Is that something that we should do going forward? We have enough information, I think, based off of June to know what to present at these meetings. But is that something we should? Okay, so I see a thumbs up from Megan. Thank you. So is that something we should maybe do every few months to do kind of like a check-in and a temperature check with you all to see how you're feeling about the topics we've been covering? See something in the chat, so I'm gonna go there. Dun, dun. Think that was an old message, so or it disappeared. Okay. I'll let you think about it as we discuss, and this leads into the next topic on how we best use this space. So some things that we've discussed about future or for future meetings are listed on this page here. So there's an MFP overview, Program of All-Inclusive Care for the Elderly, or PACE, and that's eligibility and an overview of the program, potential impacts of federal decisions. I know that that might be very timely given the bill that was just recently passed, probably about 30 minutes ago or so. Also, long-term services and supports for presumptive eligibility. Those are just some of the future meeting topics that we discussed as we were planning out this meeting. How do you all feel about those options? Do you think those are appropriate? Is there anything you would like to add? I'll give you some time in case you need to come off mute or anything. Thank you, Jesse. Jesse says these topics make sense, so we appreciate that feedback. Mm, is there anything you all feel is missing? Okay. How do you all feel that we would best use this space? Or how do y'all feel this space is best used? Is it to present these topics? Do you want something that's more like a community of practice where we're all discussing successes, challenges, providing resources? Because this space is for you, so we want to know how to best utilize it to bring you the most quality for the work that you're doing. Quiet group today? Is it because we're at the end of the week and we're right before a holiday? So let's see here. What are some other topics for meeting topics that might be available? Well, the range is kind of wide, and I think what we're trying to stick to are topics that impact you directly. Specifically, I'll talk about PACE. This week earlier, we were having some meetings, and PACE came up, and a topic of duplicative services and overlap and blending and braiding benefits, and all those things came up. So that was when we saw a need for us to probably discuss that in this wider setting and have feedback from everyone. So the what we're using, how we're picking these topics is based on the conversations that we're having with you separately and how it's informing our work and questions that are coming through that we're realizing are trends and that other people also have questions about. So I know that wasn't a specific answer to your question, Jalen, but that's how we are discovering these topics for you all. Really, we're basing it off of our interactions with you and what how you're telling us you need information and resources. Yeah, no problem at all. How do we all feel about the new third-party nurse assessor coming in August 1st? Any feedback or comments on that? Is that something you all would be interested in? And you can just wait, raise your hand. You can come off mute. This is kind of an open discussion part, even though I know that that's a little bit later on in the agenda. But we really want this space to be a community of practice. We want to hear from you. We want your input to guide how we direct the space and how we use it, who we bring to present information to you, what's beneficial, what's not. Like, so we're talking about the things that are working. Is there something that is not working, something that you don't want to see going forward? That's something we would want to know too.
Jalen has a hand raised. Thanks, Jalen.
I'm so sorry, Jalen. I was looking at the chat. Please go ahead.
Oh, that's okay. Thank you so much, Jay. Thank you, Amy. One of the major concerns that I have, and hopefully I communicate this in a good way, is surrounding the nurse assessor and some of the communication we've received from HICPUF on the testing that was used to verify that um, oh gosh, the assessment that they will be utilizing makes sense for our HCBS members, new CFC members. But one of the things that we have major concerns with is if the nurse assessor is going to be going into the home and just drastically decreasing hours on folks. One of the reasons we identified that as a concern is because the assessment tool that the nurse assessor plans on using was not tested on members actively on HCBS or utilizing IHSS or CDOS. To my knowledge, that assessment tool was tested at a long-term home health provider agency, as well as I think one or two others. And they drafted that from the previous children's assessment tool. I might be getting a little bit lost in the specific words and documents, so I apologize if that's incorrect. But that is something that's really worrying to me. Um, and I think that's worrying to a lot of members of our community as well. And to continue on to that conversation a little bit, it's if we see these drastic decreases in services, how is a provider agency for IHSS, let's say, um, identifying that there are incorrect authorizations there? Like, how are they going to advocate for those increase in hours? Different things like that. So I don't know if I communicated that the best, but
No, that was good, Jalen. I think I understand. It sounds like I heard two questions there, and one of them is I guess, the process of the nurse assessor, how they develop that tool, and then more clarity on the process of how they are using that tool with members. Did I hear that correctly?
yes, I think so. And then I
Okay.
think even a third thread would be some clarification on what it means for the case management agency to have the final decision on hours.
Okay.
And I could
So
talk
it's
about that more specifically too.
sure. So it sounds to me like it would be beneficial to have someone come and present and be available to answer questions and discuss that program better. So that's definitely something that we'd want to consider for a future meeting topic, sooner rather than later, it sounds like too. So I appreciate that information, and we will make note of that and see who we can find to come and present that information and discuss that with you all. And then
Okay.
the second thing I heard, and now I just lost it. I'm sorry, Jalen.
Oh, that's okay. Was it pertaining to the case management agency and our final authorizing decision over the nurse assessor tool?
No, that wasn't it either. It will come back to as soon as I start talking
Okay.
about the tool and bringing someone in, I lost the second thread of the question you were asking. I'm sorry. So hopefully we'll come back.
Okay. Thank you.
You're welcome. Does anyone have any feedback or questions about that as well? I don't see any more hands up. And while we're waiting, I'm just thinking of the second thread to your question. I was just reading to see if any other questions came through or if anyone had any input on any of the other thread lines. Oh, good. I'm not on mute. Apologies. Thought I was on mute there for a moment as well. And I know we have a quiet group today, but we really want this to be an open conversation. So if anyone has any feedback with their experience on the nurse assessor tool, any other challenge, I think it's appropriate to bring those things up so that we know what to address. And like I said, I do understand that this time it's an awkward time for us at meeting, and we have people out and things like that, but we still want to respect your time in this space because the space is for you. So we want to use it, effectively and ensure that you have the tools and resources and guidance you need.
Jay, I do have like a general um, concern slash thought, something that I've been thinking about. So I work for a case management agency, and one of the things that feels really prevalent to us at the moment is the amount of change that is coming to us at one specific time. 7/1 is a really big time for us, and it just doesn't feel like HICPUF is communicating between departments on the different changes that are being implemented. So, for a few examples, effective 7/1, we had the CFC changes. We had the petty auto revisions. We had the CDOS rate change letters. We had the implementation of the new RAE, regional accountability entity. We had group inReach take full effect, so we've been doing a lot of work for transitions DIs, and then even a few other small things. So that was really just a lot to put on our staff members and our CMs, and I think it was a stressor for community members too because it delayed timelines for starting services that are more complex like CDOS or IHSS. So this isn't like anything super important. I don't want you to feel like you guys are doing any bad work by any means, but it's something that has felt like a lot for us. And it's felt like a lot to handle and juggle all of those things. And one specific thing really important to me is that me overseeing the program, I have to be knowledgeable on all of those subjects. So I have to be an expert in all of these areas. And it feels really difficult to do with just so many things changing. So
Thank you for that, Jalen. I definitely think that that's valid, and we can understand your concern with that. And we do understand that July 1st, there's a lot. It's the new year for us, and there's always a lot that's coming down the pike. So we do appreciate your feedback, and we do understand the need for some type of staggered rollout of information. Now, of course, I can't speak to say if I can change that, like you said when you were talking about it, but it's definitely something for us to take back and discuss as we meet and when we meet as groups. And I can tell you that something that we are talking about doing too is just regionally discussing things because there are so many entities. There are RAIs, there are CMAs, there are TCAs, there are LCAs. There are so many different moving parts. And I definitely think that, breaking silos, and we say that a lot. So it's kind of like, what does that truly mean? Getting together at the table regionally and discussing how we all work together to best serve the community is something that we are all discussing department wide. So that is something that's on our radar, something that we recognize that's important for you all. And I think we can definitely understand how that is a lot to consume at one time and understand effectively to present to your members. So I definitely can understand that. So we do appreciate the feedback and we will be taking it back and discussing it.
thank you,
So
Jay.
thank you
I
for,
appreciate it.
you're very welcome. Thank you for bringing that to our attention. We appreciate it.
Mhm.
And then we did have another comment about the NF assessor, about being a great topic to discuss. So it sounds like there's a lot of interest around that. And then, like I was saying earlier, it also sounds like timely interest around that, something that needs to be addressed sooner rather than later. So that's definitely something we're going to put on our upcoming topics and future topics for you all. And if there's anything else that you feel is a priority to discuss before other things, one of the reasons we bought or brought someone to discuss the nutrition just was because that ranked so high. That was like the number one thing you all told us you wanted more information about. So that was what we prioritized for you. So if there's something that you feel is a priority over something else, definitely let us know so that we can identify that and work towards getting someone here to discuss that for you all. See, there's another comment. Okay, so the comment in the chat is saying, I'm new to the group, but I do like the format of presenting a program, process, changes, and updates, and then open discussion or question and resources, etc. So thanks for holding space for the meeting. You're very welcome. And I think that that's a good idea. So more of a program process and then changes and then updates. Does anyone else have any feedback or comments on that? Do we like that method or that layout for a meeting? Okay, I see some thumbs up. Okay, thank you all. Well, that's good information to take back too. So what I'm hearing is the NF assessor is priority, a format of where we discuss program, process, and changes first in our layout for this time. We'll take those back to our next TSAC prep and planning meeting. So those are not things that will fall off the radar, and hopefully you'll see those coming in our August and September meetings too. Any other feedback about future meeting topics? Any other concerns? Anything you want to see? Any other suggestions for how best to use this space? And then there's another, and I like this idea too, Deborah. So one of the comments is saying maybe since we have so many different stakeholders, having a few minutes each meeting for one to present who they are and what they do. I really like that idea. I was leaning towards not suggesting it because I wanted it to come from you all. I wanted you all to tell us what you needed versus me telling you what I think is good for you because you all know better. So that was why I didn't lean into that one. But I like that idea. Do others like that idea? Because sometimes we don't all know what we're doing, which leads back to the siloed comment I made earlier. And the only way to break that is if we take the time to step out and present and talk to and communicate with each other. So do we like that idea of someone presenting and discussing and talking about what you do? Because another thing that I've noticed is that, Rays don't know what TCAs do, don't know what this other person does. Sometimes we all don't know what we're all doing either. That's also feedback that I've been getting. Is that true for us across the board? Okay, I see some thumbs up for that too. Great way to network. I agree, Kelly. Okay. Is there a way for us to know who's going to present each time? We might be able to prepare and come with more questions. Definitely. If you all feel that it is more beneficial to send something out ahead of time so that you are aware of what's being presented, we can definitely look into that. Does that sound like something that we'd be interested in? And then maybe what we could do is as we wrap up, great, that's good. Thank you for that feedback, everyone in the chat and coming off mute. Maybe that's something too we can consider looking at in future meetings, picking a topic or a person for the next month. That way, that person has plenty of time to prepare what they're going to talk about. We can send a reminder out ahead of time before the meeting that just says, hey, this is a reminder. This entity will be presenting and discussing XYZ at our next meeting. That's something we can figure out at the end of our meeting. Since they're monthly, that gives enough time to prepare. We can have it set ahead of time. Don't know how y'all feel about that. Just a suggestion. No comments on that one, so that's fine. Okay. I was gonna say we don't have to do that either. That's fine, but okay, got some feedback on that one. We can consider it. We can switch and adapt to what works best for us too. Sorry, Deborah, you can go ahead. I'll be quiet.
Oh, no, I just wanted to say that I appreciate that. And I know I'm the one that suggested it in the first place, but just, like I said, coming in kind of brand new to everything, I came from the world of criminal justice and all this. So this is a little bit of a shift for me in terms of population, programs, services, things like that. And there's so many different people and programs and everything to learn. So the more faces to names I can put together, that would be awesome.
I agree with that. I am in this position. I've been with HICPA for about 2 years, but in this position as the transition administrator, I'm 1 month in. So I completely relate to that and I understand. So, and I definitely see the benefit in that as well. The more we can network and know what services each other provide, the more that we can be a help to the members. That's really the whole point of it
Yeah.
all. So.
Right. And I'm like, not even, 15 minutes, even if it's just five, just who you are, what you do, that kind of thing as an agency or program, that would be awesome.
Yeah, I agree. Even if it's just your elevator speech, I love that. And you can just come put
Exactly.
a face with a name, elevator speech. It won't take much time. I agree. I like that idea. So that's something we'll put on our planning meeting when we start discussing the meetings for the end of the year.
Cool.
Because we only have a few of these left. They're going to go quick. And I meant a few of these left for the year. That's all I meant. All right. Well, I appreciate all of your feedback on this. Does anyone have anything else that they want to, any other input about future meetings, how we hold this space, how we connect and work with each other and learn about each other? Okay, next slide, please. I won't stay here long because I feel like we were just talking about other ideas, but another opportunity, if there are any other ideas, any other suggestions of how you want this space to look. Okay, next slide. So now we're just at questions and open discussion part of the meeting. So I have a question. I think how did we like the format that we did this time? Like I said, we took the information from the polls, use that to inform who we were going to invite to present at this meeting. How did that work for all of you? How do you all feel about all that? You can just give me a thumbs up. You can just throw something in the chat. Was that beneficial to you? Did it make sense for us to do it that way? See some thumbs up. Thank you all. I appreciate that. Okay. Well, we have information for the next few meetings. Knowing that you all did like the poll method and having some ideas of what you're interested in, what's necessary, and what's a priority for you to get more information about is good too, and it will inform how we plan these meetings going forward. Are there any questions? Anything anyone wants to address? Right now, this is just open for anything. Open space, open time for you. Go ahead, Jennifer. And I'm sorry I'm not seeing the hands, everyone. I'm trying to keep a high eye on the chat and everything. So you can just cut me off if you need to. Feel free.
It's unable to detect the camera again.
Oh, no worries. Happy, I'll just say Friday since most of us are probably off tomorrow. This is actually Tiffany Ballou. I'm piggybacking on Jennifer's meeting invite here because I just walked in the room and I've been running around. So, I it's one of the things I would love to see out of this meeting if possible, and maybe this isn't the most appropriate one, but at some point, some sort of like it would be neat to see like a demo or a mock um presentation of like an actual client case, if you will. So like a mock individual inReach meeting, previously options counseling. Maybe use an actual client case, just of course redact any uh, protected information, and then follow that client case into maybe one that's already been successful and has already transitioned back to the community, and then also see the mock process at the TCA level. That would be really neat to see the full kind of process, but from HICPU's side.
Okay, that makes sense. I'm getting some thumbs up about that too. And I'm getting some comments about that. So, and thank you, Tiffany, for that information. And I think that's a great idea. And so you're thinking maybe that like from referral to, person transitioning. Is that what you're thinking? So from group inReach, the referral, connecting with the TCA to transitioning back into the community, kind of like the whole process for the member from the HICPUF side, correct?
Yeah, that would be really, really cool. And kind of what it sparked this thought was on HICPUF's website, there is, I think it's on the member side for transition services, the video with Jesse, that we've actually incorporated into our group inReach presentation and our SNF educations, which I think that
I love
video,
that.
having like some sort of like real person behind the program that is giving their firsthand testimony, has been really helpful and kind of bringing value to it to the folks that we're sharing this information with. And if there was a way, and I know this would probably be pretty time intensive, but if there was a way to see if there is a client that has fully gone through the entire process, who'd be willing to participate in a video like that, or maybe a couple of clients, like one, like you said, is sitting there during group inReach and do a debrief with them after, like, what do you think about the program? What did you think about the presentation? Are you interested in moving forward? And then do a separate video for, okay, so you were referred for transition, or you were referred for individual inReach from this group presentation. Here's your in-person conversation about your specific situation, the actual individual inReach conversation, and then a third video of here's how the client's experience was through the transition program process at the TCA level. And then maybe a fourth video that says, okay, I'm fully transitioned. How's life? How's it going? So just like having those four different snapshot videos or scenarios of client cases who've been through each of those processes.
That makes sense. I like that idea too. And I like the idea of breaking the process up too. So to train, and that may even be beneficial for training too. I see lots of ways we could use that video to train, to inform, to and humanize the process as well. You know, we're here, we're doing the work, but we're all doing this work for the members. That's the goal, to ensure that they have what they need and the support they need from us. So thank you for that suggestion, Tiffany. I think that that's good, and we'll take that back as well.
You bet. And one other one that I wanted to mention too, completely separate, is more education about the raise. I will be transparent. I've been in role for about a year and a half now, and didn't really know anything about transition services prior to that, for the most part. And so I barely know. I feel like anything about the Ray, and in our region specifically, our ADRC really hasn't had much interaction with them. And yeah, I see a chat in there, especially since the Ray regions changed this year. Um, so any information on the Ray, like what the requirements are for them, expectations on their end, like what kind of support can we and education can we provide about them to members?
Yes, I think that that's very appropriate. And that was something we were discussing earlier too, just because sometimes we don't know what they do and they don't know what you do. And so there's this lag in information, because I know that some of the Rays don't know what the TCAs do and vice versa. So I definitely think that there's some room and opportunity there for us to share that up. So, and one thing we were considering too, Tiffany, is regional meetings. So this is something that's in work right now, but it's gonna be a minute before we get it all off the ground. But that's something we're considering, are regional meetings, specifically the regional meetings, because you will be the entities that are working with the members that are in that region. So knowing how you all work together and how you can all support each other and provide resources to these members would be invaluable. Like, it would really increase the value for the members. So it's something we're considering. So it's great to get that feedback from you, because you're not the only one. That's not the first time I've heard that, probably this week. So that's definitely something that we're considering and we're taking back and working on rolling out some regional meetings so that we can all get together at the table and discuss how we can work together.
Thank you. Yeah, and I do want to mention too, so as part of, since we're the local contact agency, as part of our deliverables, we are required to do a quarterly regional meeting. And we had our Ray come at our last meeting, but happy, like if HICPUF ever wants to come along on one of those meetings, we can do all the whole meeting together instead of scheduling a separate quarterly meeting. So we do have that in place, but we haven't had the opportunity to really meet with them in depth and have a full understanding of again, that expectation of like what it is that their the roles and responsibilities essentially.
Yeah. Thank you for that. Yes. And that was mentioned recently too in a meeting I was in about the LCA quarterly meeting and how that's required and how that might be an opportunity. But I also think, like you just said, it's important to consider, maybe a separate space where it's specifically talking about, what everyone does and how we can work together. So I think that that's very timely and valid, Tiffany. So thank you for that. And it's something we're considering. I've had a couple of conversations this week alone about it. So may take some time to get it rolling, but it's something we definitely want to do. And it will be just so helpful to everyone to know what we all do, how we work together, and how we can support these members. Thank you for that conversation. Does anyone have anything to add to that? And I just wanted to say, Tiffany, there's also in the chat that other people do agree that is a good idea, seeing the process through the whole loop, and especially since the Ray Regents changed, which you mentioned earlier. So very timely as well. Any other comments, questions, feedback?
Me again. I know one of my staff was like, it's been pretty quiet in the meeting. And I was like, it's because I haven't been here. So
You're
sorry
good.
about that. I tend to talk a lot. So I was also wondering, and this might not be the forum, so totally okay if there's no answer on this, and I don't really think there is. But our team our ADRC for our information and referral line is already receiving calls about the bill that the administration is set to sign. Um, I'm assuming the state probably doesn't have anything official to even say or comment on this at this point, but I wanted to see if you happened to know of anything going on at that level that you were able to share, or if it's just kind of everybody doesn't know what's going on yet until something official happens.
Yeah, no, I think that that's an important question, and especially since it just happened like right before we kicked this off, or right as we were kicking this off. So earlier in the meeting, we talked about how we could use this time to discuss federal implications and federal changes and how they're going to impact our work. So that's something that we would definitely keep on for future topics. Yep, there it is, potential impacts of federal decisions. So that's something that we're going to consider. And then thank you, Chanel. I was going to drop that in there too. We did receive an email, and I know that our director has a public comment on the website right now about it. And I think that that's the link that Chanel just dropped into the chat. And so I haven't gotten to read through the whole email yet because it like just happened. Like I started getting these news alerts, so I haven't gotten to read through them all yet. But there's the most recent information we have. And thank you, Samantha. Thank you, my lovely colleagues, for dropping those links in the chat. So there go some resources right there, and that's the most up-to-date information we have. So I think a lot of it is going to be waiting to see. From what I did read too, I did notice that some of it won't be until December of next year, but there are still some implications and things we need to consider and plan out. So I think your concerns and wanting to know information about that is understandable. And that second link, I think, is Kim's public message. Kim is our director here at HICPUF. So that's the information we have on that. Cool. And I think that
Thank you. That's super helpful.
Oh, you're very welcome. I'm sure that that question is on everyone's mind. It was on mine too. So, any other questions, comments? I'll hang out and be quiet for just a little bit, just in case anything pops up. But I don't want you all to feel forced into, making comments or, saying anything. So I'll hang out for a little bit and be quiet just in case anything comes up. And then if not, we can close.
If I can just say this is Bishop with the Love Foundation, to give a plug for Group Reach. We have had a couple of referrals.
LaShawn, I'm having a hard time hearing you. I'm
And
sorry.
that's because I don't have my camera up and sometimes it does that. Sorry about that.
You're good.
I just wanted to give a shout out to Group Reach, who we have received several members as a result of their work out in the community at the facilities. And so we've had members that have been able to speak to their experience with Group Reach fully, which got them piqued their interest into transition services. So I just wanted to give a shout out to Chanel and the team for their work out in the community.
That is wonderful. Thank you, LaShawn. Yes, kudos to Chanel and team. You all are wonderful, and we appreciate all the support. I've received a few of those referrals from InReach as well as I'm working through the TCA referral request. So that's wonderful, and I'm glad that you are seeing positive results from that, LaShawn. So thank you for the kudos too.
Yeah. And I also wanted to throw out that Group InReach has mostly transitioned to the LCA. So they've been doing a lot of that work too, LaShawn. So we do have a couple regions where we don't have contract signed that we're still going out to, but mostly all of that work for the past year since like October has been done by the LCA. So we do appreciate them taking that on. And I'm glad to hear that it's finally filtering through and you guys are seeing some of those referrals. That's good to hear. Thank you for sharing.
You're welcome. Chanel, I also want to give kudos out to you and Matt's team for all of the suspended items for staying on top of and the dedication to making sure that providers are or TCAs are being paid out for those suspended items to better understand it. So I want to thank you guys for the efforts there as well.
Thank you, LaShawn. I love to end on a kudos and good stuff and good news. So I love to hear it. Thank you for that. Well, like I said, I think that's great to wrap up with kudos to the two teams, Access Unit, InReach, the LCAs, TCAs, all the great work that everyone is doing. And thank you for taking this time to come and meet. And I know it's hard to engage in conversation when you don't know what you want to say. So I thank you all for your patience and chiming in and giving us the feedback and all the things we need to ensure that we can make this space efficient for you and useful for you. So I appreciate you all. If you don't have any other questions, I'll hang out for a few minutes. But if you don't have any other questions, thank you for joining us. Enjoy the weekend and have a happy holiday.
Thank you, Jay.
You're welcome. Thank you. Thanks, Tiffany and Jennifer. I'm going to go ahead and stop recording now, too, because